Imagine a world where your body's defenders, your white blood cells, become your enemies. What would happen then? Let's take a moment to consider the vast battlefield that is the human body. Every day, countless invaders seek to breach our defenses and wreak havoc on our inner world. Yet we remain largely unscathed thanks to our valiant defenders, the white blood cells. These microscopic soldiers are the unsung heroes of our immune system, tirelessly patrolling and protecting our body from harmful threats. White blood cells are a diverse group, each with a unique set of weapons and strategies to combat invaders. Neutrophils, for instance, are the frontline soldiers, rushing to the site of infection and swallowing up the enemy. Then we have the lymphocytes, the intelligent agents of the immune system, who can remember past invaders and launch a swift counterattack if they dare to return. But what happens when these defenders turn against us? What occurs when the very cells meant to protect us start causing harm instead? Welcome to the complex and intricate world of white blood cell diseases. White blood cell diseases are a group of disorders that affect the production and function of your white blood cells. This could mean your body either produces too many or too few white blood cells, or they might not function correctly. The results can be devastating, ranging from a weakened immune response, leaving the body open to severe infections, to an overactive immune response, causing damage to healthy tissues. These diseases are as varied as the cells they affect, including conditions like leukemia, where the body produces an excessive number of immature white blood cells, to neutropenia, a condition where neutrophils are dangerously low. Understanding these diseases is not just about knowing the biology behind them, but also about appreciating the delicate balance our bodies maintain to keep us healthy. When this balance is disrupted, the consequences can be severe. In this video, we will explore the intriguing world of white blood cell diseases. First on our list is a well-known white blood cell disease, leukemia. A complex and multifaceted illness, leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. It results in an abnormally high production of immature or abnormal white blood cells, which we call leukocytes. These rogue cells are not fully developed and are unable to function properly, crowding out the healthy cells and leading to a host of symptoms. The causes of leukemia are still not fully understood, but a combination of genetic and environmental factors are believed to play a role. Exposure to high levels of radiation, certain chemicals, and some chemotherapy drugs have been linked to an increased risk of developing this disease. Symptoms can vary, but common ones include fatigue, frequent infections, unexplained weight loss, easy bruising or bleeding, and swollen lymph nodes. Now let's delve into the two major types of leukemia, acute and chronic. Acute leukemia is characterized by a rapid increase in the number of immature blood cells, making it a fast-progressing disease that needs immediate attention. Acute leukemia is further divided into acute lymphoblastic leukemia and acute myeloid leukemia, depending on the kind of cell affected. On the other hand, chronic leukemia progresses more slowly and involves more mature cells. It can go unnoticed for years until it's accidentally discovered during a routine checkup. Chronic leukemia is also categorized into two types: chronic lymphocytic leukemia and chronic myeloid leukemia. Whether acute or chronic, leukemia disrupts the normal balance of cells in our blood and wreaks havoc on our immune system. It's a battle within our bodies, where the soldiers meant to defend us have turned into the enemies. And the worst part is, this battle is often silent, showing no symptoms until it's too late. In the end, understanding the different types of leukemia, their causes and symptoms is key to early detection and effective treatment. Leukemia, a silent and deadly battle within our bodies. Next up, we delve into the realm of lymphomas. Imagine your body as a fortress. The lymph system, with its network of vessels and nodes, acts as the sentinels, guarding your fortress against harmful invaders. But what happens when these sentinels fall sick? Lymphoma is the name of this catastrophe. It's a type of cancer that originates in the lymphocytes, the soldiers of our immune system. These cells, when healthy, fight infections and diseases. But in lymphoma, they transform into rogue cells, multiplying uncontrollably, forming tumors in lymph nodes and other parts of the body. In essence, our body's defenders become the destroyers. Now let's break it down further. Lymphoma is generally divided into two main types: Hodgkin's and non-Hodgkin's lymphoma. Hodgkin's lymphoma, named after the physician Thomas Hodgkin who first identified it, is less common. It's characterized by the presence of a specific abnormal cell called the Reed-Sternberg cell. Hodgkin's lymphoma can start anywhere, but it most often begins in the lymph nodes in the upper part of the body, such as the chest, neck, or under the arms. It typically spreads in an orderly manner from one group of lymph nodes to another. On the other hand, non-Hodgkin's lymphoma, which is more common, has many subtypes. Each behaves differently and requires a different treatment approach. Unlike Hodgkin's, non-Hodgkin's lymphoma can start at any part of the body and spread in a non-orderly manner. It's a bit like a wildfire, unpredictable and difficult to control. In both types, the symptoms are often subtle and can be easily overlooked. They may include swollen lymph nodes, fever, night sweats, or unexplained weight loss. So it's crucial to be aware and seek medical help if you notice any unusual changes in your body. Lymphoma, a disease that can silently wreak havoc in our lymph system. But with early detection and appropriate treatment, many people with lymphoma can lead a normal life. The fight against lymphoma, like any other battle, is about knowing your enemy and being prepared. Now, let's turn our attention to a lesser-known white blood cell disease, myelodysplastic syndromes. Diving into the world of complex blood disorders, myelodysplastic syndromes, often abbreviated as MDS, represent a group of conditions that impact the bone marrow's ability to produce healthy, functioning blood cells. This hidden menace is often caused by damage to the cells of the bone marrow, which could be due to various factors like certain chemotherapy drugs, radiation therapy, or even exposure to certain chemicals and heavy metals. Now you might be wondering, how does this disease manifest itself? Well, it's a bit of a silent storm. You see, in the early stages, individuals with MDS may not exhibit any symptoms at all. As the disease progresses, however, symptoms may include fatigue, shortness of breath, easy bruising or bleeding, and increased susceptibility to infections. Essentially, the body's defense system starts to crumble from the inside out. But the real crux of MDS lies in its impact on blood cell production. The bone marrow in a healthy state is a bit like a well-oiled machine, producing a steady stream of red and white blood cells along with platelets. In the case of MDS, however, this machinery goes awry. The bone marrow starts producing blood cells that are misshapen and defective. These cells often die before they can reach the bloodstream, leading to a shortage of healthy blood cells in the body. This shortage can have drastic effects. The lack of red blood cells can lead to anemia, causing fatigue and weakness. A reduction in white blood cells can leave the body defenseless against infections, and a decrease in platelets can result in easy bruising and excessive bleeding. It's a complicated disease, to say the least, with a ripple effect that extends throughout the entire body. The disruption in blood cell production can lead to a host of complications, painting a clear picture of how integral our blood cells are to our overall health and well-being. Myelodysplastic syndromes, a complex disease that disrupts our body's blood cell production. As we've seen, white blood cell diseases are as diverse as they are intriguing. Let's take a moment to revisit what we've learned. We began our exploration with leukemia, a group of cancers that start in the bone marrow and result in high numbers of abnormal white blood cells. These cells are not fully developed and are called blasts or leukemia cells. They can invade the blood fairly quickly, spilling out into the bloodstream and spreading to other parts of the body. This is a disease that requires immediate attention, and thanks to modern medicine, it's now more treatable than ever. Next, we turned our attention to lymphomas, cancers that begin in the lymphocytes, a type of white blood cell. We learned about the two main types, Hodgkin lymphoma and non-Hodgkin lymphoma. While both involve the lymphatic system, they differ in their behavior, how they spread, and how they respond to treatment. Research is ongoing, but early detection and targeted therapies have improved survival rates significantly. Our journey then took us to the myelodysplastic syndromes, a group of disorders caused by poorly formed or dysfunctional blood cells. In these cases, the bone marrow does not produce enough healthy blood cells, leading to a host of potential complications. Like many white blood cell diseases, the key to managing myelodysplastic syndromes lies in early detection and appropriate treatment. Throughout this exploration, one message has been clear. Early detection and treatment are crucial. The sooner these diseases are identified, the sooner a treatment plan can be put into place. Advances in medical technology, including more precise diagnostic tools and more effective treatments, have transformed the prognosis for many of these conditions. In conclusion, our bodies are a complex network of cells and systems. When one element, such as white blood cells, falls into disarray, it can have wide-ranging impacts. Yet, with knowledge and vigilance, we can better understand these diseases, navigate their challenges, and ultimately improve outcomes. Remember, knowledge is the first line of defense against these diseases. Stay informed, stay healthy.